Hi, this is Dr. Dennis Clark, research scientist and natural products chemist. Today I'm here to give you just some pointers on shingles. Shingles is, of course, now that you probably have wondered if you have it, realize that it's a herpes virus. It's the chickenpox virus called herpes zoster that normally you have as a child and comes back to afflict you later in life when your immune system gets a little suppressed, usually not until you're 50 or 60 years old. Now it's becoming more common in younger people, and it shows up as the same virus, however, in different symptoms. And I want to talk about the symptoms today. The symptoms as a group are called shingles, and partly it's because of what they look like. They primarily cause outbreaks that will begin to feel like a stinging or a burning sensation before the skin actually shows any scabbing or any rash. Mostly around the trunk area, right around this part of your body, maybe a little bit lower around your tummy, etc. It'll cause a rash, it'll turn red, it maybe even cause a pussy outbreak that will last for a few days or no more than a couple of weeks. Okay, that's what you find out early on, that the herpes virus is starting to attack the nerve endings, and so you start to feel it. Then it attacks the skin cells, then that's when you start to see it, and it lasts for no more than a couple of weeks. Shingles, though, is different than what it was when it was chickenpox, because what happens once the outbreak is gone, the virus is even completely gone. It goes back to where it hides, which is generally in the bases of your nerve ganglia. That's just a fancy word to say that it hides in your nerve tissue, so the immune system isn't able to eliminate it. What happens after that 2-week period is that there's some residual pain. This is the final phase of a shingles outbreak, and it really has nothing to do with the virus being there anymore. It is only the leftover pain. In fact, medical people call it post-herpetic neuralgia, post-herpetic neuralgia, or PHN. This particular pain can last for a few weeks, a few months, or even a couple of years. So the important thing is to get treatment for that. I've got some ideas for herbal treatments. I'll tell you about that in another video. Meanwhile, I'll refer you to my blog, naturalshingles.com. There's a lot of information there, and a book I've written about natural treatments for shingles, how to control them naturally, including post-herpetic neuralgia. That's really the problem with the shingles outbreak once it's gone, and that's the part that kind of ruins people's lives, because they hurt every day, even though the virus has been gone for months or years. So those are some of the symptoms to watch out for. If you've got something like that, been diagnosed as shingles, then you certainly have to watch out for post-herpetic neuralgia. That's the problem that really causes more difficulty with shingles, with people that have shingles, than anything else. This is Dr. Dennis Clark. Thank you.